Democrat supporters of this law basically made a covenant with the American people. They put on a pretty good show.
All right, when it comes to Obamacare, everybody is apparently not equal in the eyes of the Obama administration. Wisconsin Republican Senator Ron Johnson filed suit today challenging the special treatment of members of Congress. While millions of Americans are being forced to buy Obamacare insurance plans, senators, congressmen, and their staffs largely exempt. They get more choice in the federal health care plan and far more subsidies. That's dead wrong. That's just political cronyism. Let's talk about some of that and other things. We have Forbes opinion editor Avik Roy. He's also senior fellow at the Manhattan Institute and author of How Medicaid Fails the Poor. First of all, Senator Johnson is right, is he not?
Yeah, he's right. I mean, well, let's put it this way. The administration went through an extra legal mechanism to ensure that they could still get this subsidy for their health care. And it was a poorly written provision in the law. So it's actually ambiguous as to what the law actually says, because it's thrown out there at the last minute. It was a Chuck Grassley amendment. And so there are a lot of problems with it. But here's the thing. Ron Johnson is right to criticize this, and in general, he's one of the good guys who's offering solutions. But where's the Republican bill to reduce the rate shock in Obamacare? That's the policy problem with Obamacare. This stuff with what Congress is getting paid and their staffers are getting paid, yeah, it's an important issue and it's attracted a lot of interest, but it really isn't what affects average Americans as much as the real issues.
Just one add-on to that. The Republican leadership never really supported abolishing the abolition of the exemption. They never really supported it. A lot of people think the staff lobbying, you got a lot of six-figure salaries, pre-tax dollars, they get large subsidies. The federal employment, whatever it's called, health thing is much nicer, much more choice than the Obamacare.
A lot of the House Republicans and the
GOP was pretty squishy on this.
Well, I mean, a lot of them did support this. Some didn't, but a lot of them did. I'd say the majority did support what Ron Johnson's trying to do. But again, as important of an issue it is, and I know that a lot of people, when I write about this for Forbes, it gets massive traffic because there's so much interest out there on it. But at the end of the day, compared to the 2,000 pages of Obamacare and 20,000 pages of regulations, this is a tiny portion of the bill. If you knock this out, Obamacare as it is and how it's actually affecting real people won't be changed one bit.
All right, let me ask you another one. AP story circulating today. If you have a child, you get married, you get divorced, if you die, if you get a new job, if you have a change in income, it doesn't work through the Obamacare website. It doesn't get scored. What's the story with that?
Yeah, there's all sorts of issues. And I mean, one could go on and on about all the problems with the website.
I don't know whether it's worse. I mean, having a child, that's great. Is it worse? Divorce, death? I can't figure it out. But none of it is scored through the website.
Yeah, not only that, but sometimes people are getting inaccurate prices for when they try to shop for these plans because they're getting approximate prices. They might be surprised when they actually get their first bill in the mail and have to pay the insurer.
All right, so where do they go for relief?
Well, they don't have many options, right? Because what's going to really happen is all that stuff is going to hit next year. When people file their 2015 tax returns for their 2014 tax year and they haven't signed up for the right plan, or they didn't sign up for insurance at all, or their income changed in the middle of the year and they're no longer eligible for the subsidies, they're going to have to pay a clawback or a fine or something like that, and the IRS is going to have to enforce that.
Aren't they going to go to the insurance company? I mean, isn't the burden of this going to be on the insurance company?
The insurance company,
months and months ahead.
They're really worried about that. They're worried that they're going to get blamed when you go to the doctor and you think you have coverage, and the doctor calls the insurance company and they say they have no record of it. But the insurance companies, I think, have done a lot to express that, and I think a lot of people at least are aware of this problem.
All right. Obama administration put out some numbers today that says, see, we told you so. Obamacare, which was implemented in 2010, has slowed health care spending. Now, it's only a smidge. As a share of the economy, it's gone 17.2% of GDP from 17.3%. Looks like most of it's prescription drugs. But I just want to ask you, does Obamacare deserve credit for slowing health costs?
Well, no. First of all, the law hasn't really been implemented, right? It's only just starting to be implemented. The CMS report from the Obama administration explicitly said that the Affordable Care Act had minimal effect on national health expenditures. It was really driven by prescription drugs. And you know what causes prescription drugs to slow down? It's George W. Bush's
choice.
George W. Bush's Medicare prescription drug reforms, the Hatch-Waxman bill from 1984, those are the things that are driving this. And it's really since 2002, 2003 that healthcare spending and the growth in healthcare spending has slowed down. Obamacare has had no effect, and it's going to turn that curve back upwards.
But that's what I want to know. I mean, the recession, I think, helped bring down healthcare costs,
Absolutely.
too. But let me just ask you, let us assume we have this sort of modest recovery, but now Obamacare continues along its merry way, and premium costs go up and prescription drugs. What's going to happen to health costs? Does the curve bend up again?
It will. It depends on who you are and why, but yeah, in general, because your premiums are going to go up so much, health spending is going to go up. But what does that mean? People's discretionary income is going to go down. So general discretionary consumer spending should be affected by this massive jump in healthcare premiums.
So you think, from that standpoint, if nothing else, it's going to be a failure?
Well, failure in whose terms, right? If you're a liberal who believes that universal coverage is important, it doesn't matter whether the program actually works or how much it costs or how much it saves, then you think it's a success. For other people who use those other economic principles as the standard of success or failure, they're not going to be so happy.
All right, Avik Roy, thank you very much. We appreciate it.